Mental health disorders can have a severe impact on an individual's life, leading to social isolation, loss of productivity, and overall poor quality of life. Fortunately, advances in modern medicine have led to the development of antipsychotic medications that can alleviate the symptoms of these disorders and improve the quality of life for those who take them. One such medication that has been making waves in the psychiatric community is aripiprazole. This revolutionary antipsychotic drug has been shown to be effective in treating a range of mental health disorders, including schizophrenia, bipolar disorder, and major depressive disorder. In this video, we'll take a closer look at aripiprazole, its benefits, and how it can help those who suffer from mental health disorders to live a more fulfilling life. So, if you or someone you know is struggling with a mental health disorder, watch on to learn more about this groundbreaking medication. Understanding antipsychotic medication. Antipsychotic medication is a class of drugs used to treat mental health disorders characterized by symptoms such as delusions, hallucinations, and disordered thinking. These drugs work by regulating the levels of neurotransmitters in the brain, specifically dopamine and serotonin. Dopamine is a neurotransmitter that is associated with reward and pleasure, and an imbalance of this neurotransmitter can lead to symptoms such as hallucinations and delusions. Serotonin is a neurotransmitter that is associated with mood regulation, and an imbalance of this neurotransmitter can lead to symptoms such as depression and anxiety. Antipsychotic medications can be categorized into two classes, typical and atypical. Typical antipsychotics, also known as first-generation antipsychotics, were the first medications developed to treat mental health disorders. They work by blocking dopamine receptors in the brain, which can reduce symptoms such as hallucinations and delusions. However, typical antipsychotics are associated with a range of side effects, including movement disorders and weight gain. Atypical antipsychotics, also known as second-generation antipsychotics, were developed in response to the limitations of typical antipsychotics. These medications work by regulating both dopamine and serotonin levels in the brain, which can lead to a reduction in symptoms such as hallucinations, delusions, and mood swings. Atypical antipsychotics are also associated with fewer side effects than typical antipsychotics. How aripiprazole differs from other antipsychotics. Aripiprazole, also known by its brand name Abilify, is an atypical antipsychotic that was approved by the FDA in 2002. Aripiprazole differs from other atypical antipsychotics in that it has a unique mechanism of action. While other atypical antipsychotics work by blocking dopamine and serotonin receptors in the brain, aripiprazole works by regulating the activity of these receptors. Aripiprazole is a partial agonist of dopamine and serotonin receptors, which means that it can both activate and block these receptors depending on the level of neurotransmitters in the brain. This unique mechanism of action makes aripiprazole a highly effective medication for treating a range of mental health disorders. Aripiprazole has been shown to be effective in reducing symptoms of schizophrenia, bipolar disorder, and major depressive disorder. Additionally, aripiprazole has been shown to have a lower risk of side effects than other atypical antipsychotics, making it a preferred choice for many individuals who suffer from mental health disorders. Benefits of aripiprazole. Aripiprazole has a range of benefits for individuals who suffer from mental health disorders. One of the primary benefits of aripiprazole is its ability to reduce symptoms of schizophrenia. Schizophrenia is a severe mental health disorder characterized by symptoms such as delusions, hallucinations, and disordered thinking. Aripiprazole has been shown to be highly effective in reducing these symptoms, leading to an improvement in quality of life for individuals who suffer from this disorder. Aripiprazole has also been shown to be effective in treating bipolar disorder. Bipolar disorder is a mental health disorder characterized by extreme mood swings, ranging from depressive episodes to manic episodes. Aripiprazole has been shown to be effective in reducing both manic and depressive symptoms in individuals with bipolar disorder, leading to a more stable mood and improved quality of life. Another benefit of aripiprazole is its ability to reduce symptoms of major depressive disorder. Major depressive disorder is a mental health disorder characterized by persistent feelings of sadness and hopelessness. Aripiprazole has been shown to be effective in reducing these symptoms, leading to an improvement in overall mood and quality of life. Side effects of aripiprazole. While aripiprazole is associated with fewer side effects than other atypical antipsychotics, it is still important to be aware of the potential risks associated with taking this medication. Common side effects of aripiprazole include nausea, vomiting, and constipation. Additionally, aripiprazole may cause drowsiness or dizziness, which can impair an individual's ability to perform certain tasks such as driving or operating heavy machinery. Less common side effects of aripiprazole include weight gain and movement disorders such as tardive dyskinesia. Tardive dyskinesia is a disorder characterized by involuntary movements of the face and limbs, which can be irreversible in some cases. It is important to discuss any potential side effects of aripiprazole with your healthcare provider before starting this medication. Your healthcare provider can help you determine if the benefits of aripiprazole outweigh the potential risks. Who can benefit from aripiprazole? Aripiprazole can be beneficial for individuals who suffer from a range of mental health disorders, including schizophrenia, bipolar disorder, and major depressive disorder. Aripiprazole is typically prescribed for individuals who have not responded to other treatments, or who have experienced intolerable side effects from other medications. It is important to note that aripiprazole should only be taken under the guidance of a healthcare provider. Your healthcare provider can help you determine if aripiprazole is the right medication for your specific condition, and can monitor your response to the medication to ensure that it is effective and well tolerated. Aripiprazole dosage and administration. The dosage of aripiprazole will vary depending on the individual's specific condition and response to the medication. Aripiprazole is typically taken orally, either as a tablet or a solution. The medication is usually taken once daily, with or without food. It is important to follow your healthcare provider's instructions regarding dosing and administration of aripiprazole. Taking too much aripiprazole can increase the risk of side effects, while taking too little may not effectively manage symptoms of mental health disorders. Frequently asked questions about aripiprazole. Q. How long does it take for aripiprazole to work? A. Aripiprazole can take several weeks to start working, and may take up to 6 to 8 weeks to reach its full effect. Q. Can aripiprazole be taken during pregnancy? A. Aripiprazole is classified as a Category C medication during pregnancy, which means that there may be potential risks to the fetus. It is important to discuss the risks and benefits of taking aripiprazole during pregnancy with your healthcare provider. Q. Can aripiprazole be taken with other medications? A. Aripiprazole can interact with other medications, including antidepressants and antipsychotics. It is important to discuss all medications you are taking with your healthcare provider before starting aripiprazole. Conclusion and final thoughts. Aripiprazole is a revolutionary antipsychotic medication that has been shown to be effective in treating a range of mental health disorders. This medication has a unique mechanism of action that makes it highly effective in reducing symptoms such as hallucinations, delusions, and mood swings. Additionally, aripiprazole is associated with fewer side effects than other atypical antipsychotics, making it a preferred choice for many individuals who suffer from mental health disorders. If you or someone you know is struggling with a mental health disorder, it is important to seek professional help. A healthcare provider can help determine the best course of treatment for your specific condition, which may include medications such as aripiprazole. With the right treatment and support, individuals with mental health disorders can lead fulfilling and productive lives. Thanks for watching.